Assalamu alaikum everyone. I'm Dr. Farnaz and we have with us here today Dr. Altaf Hussain, who's a renowned otolaryngologist of Pakistan. So Assalamu alaikum Dr. Altaf.
Walaikum salam.
So Dr. Altaf, we have brought you here today to basically throw a few questions at you. So our first question is related to, all the allergic conditions that have been going around. It's a worldwide phenomena. It's, a global occurrence. However, when we talk about Pakistan, so allergic rhinitis is often dismissed as a minor allergy. So how common is allergic rhinitis in Pakistan, and why should we actually take it more seriously?
Thank you so much, Dr. Farnaz, for inviting me here for this important condition of allergic rhinitis. Allergic rhinitis is progressively increasing all over the world, and especially in Pakistan, it is on rise. Approximately 30% of adult, and even it is more prevalent in children, it is almost 40%. And allergic rhinitis is not only that it impairs the quality of life of the patient in terms of sneezing, runny nose, nasal obstruction, or itching eyes. It disturbs the whole life of the patient. It disturbs the sleep of the patient, his alertness, he would have memory problems. The children will be unable to go their schools. They will have a lot of absenteeism. And also for those who are working, for them it impairs their work productivity. So in terms of overall quality of the life of the patient is significantly impaired with this condition.
All right, thank you so much for such a brilliant insight that you have provided us. So why is allergic rhinitis a significant problem, particularly in Pakistan, and why is it seen to be growing rather than staying constant or decreasing, like as compared to other Western countries? Why is it so prevalent here?
Dr. Farnaz, allergic rhinitis is becoming a significant problem in Pakistan because of three main reasons. One is environmental. As you know, the environment of all over the global warming is something which is significantly impacting the weather of the whole of the world. And in some regions, like in Pakistan, the extreme weather has created a lot of problems. Number two, the lifestyle of our patients are not appropriate or healthy. Lack of exercise, they are mostly inside in their offices and their homes. And number three is the pollution. You know very well that in last few weeks, Pakistan was one of the top in the world in terms of pollution. Our air quality index was significantly poor, especially in northern part of Pakistan. So this pollution is creating a lot of problem to our patients. So all these are triggers in our patients to making their allergic rhinitis even more worse.
Thank you. All right, so when we are choosing an antihistamine for allergic patients, what are some of the most important factors you consider to ensure both safety and effectiveness?
Dr. Farnaz, the treatment for allergic rhinitis is mainly, first of all, to avoid the allergens. As much as one can effectively control all these triggers, the symptoms will be less. The next important thing is the medical treatment. Among medical treatment, we have the option is antihistamines. And in antihistamine, the most important, there are three things. One is the efficacy. The antihistamine which is prescribed should be have a great efficiency to control all these symptoms. It should have a safety, mainly in neurological or cardiological point of view, that these antihistamine should not cross the blood-brain barrier, because already the patient life is compromised because of the allergic rhinitis, and his sleep and alertness is disturbed. And with the antihistamine, if he gets more drowsy, that will create his problem even worse. And the third is like tolerability, safety. The safety in terms mean that it should not, like, the interaction with other medicine should be less. And our patient prefers to have a medicine, a treatment which is like dose convenient. They don't prefer to take medicine 2 or 3 times a day. So if it is dose convenient, that is like good choice for a physician for his patient.
All right, and for patients who are functioning on a daily basis and patients who drive on a daily basis, work long shifts, or are students who need to be mentally alert all the time, how clinically relevant and important is the non-sedating profile of an antihistamine?
Dr. Farzan, you have asked a very relevant, very important question. Yes, being physician, we consider the profession of the patient as a top priority, and all those like school-going children or students or all those who are working, especially those who are driving on the road. So for that, giving the medication is a prime importance for us, because if they are not alert, their work will be significantly disturbed with their loss of reduction in their alertness. And we keep this factor in mind while prescribing an antihistamine to our patient.
Okay, so Dr. Altaf, various studies have shown that fexofenadine doesn't cause drowsiness, and it works similarly to placebo in terms of sedation. So how does this evidence support its use as a truly non-sedating antihistamine?
Yes, I agree that fexofenadine is a truly non-sedating antihistamine. And among various clinical trials, now it has been very clear that the fexofenadine effect on the CNS is almost negligible, and in various comparable studies, they have proved it that the level of sedation which produces by the fexofenadine, it is almost equivalent to a placebo. So it's a very effective drug in my practice, which causes almost no sedation in patients.
But still, there are many patients who wonder whether a non-sedating antihistamine like fexofenadine is actually strong enough to control allergic rhinitis. How effective it is really? It is sedating, it is non-sedating, as you just said, but how effective it is?
So, Dr. Farzan, the effectiveness is almost comparable, or even better with some other antihistamine. It gives almost 100% result in controlling all the symptoms of allergic rhinitis, and have minimum side effect like drowsiness. The patient remains alert. It is like very conveniently to take once in a day, and it has no interaction with other medication. So I think prescribing fexofenadine to the patients of allergic rhinitis, it is like one of the topmost antihistamine in the treatment of allergic rhinitis.
Okay, and now moving on to the last question, and I would like to request you to share your personal clinical experience with the use of fexofenadine, and especially with relevance to the patient compliance that you have seen in patients who have come on a follow-up visits, and what was their experience with the use of it. You may look into the camera and you may share your experience.
Okay, Dr. Farzan, I have been using fexofenadine for the last almost 25 years, since the fexofenadine has been launched in Pakistan. So I have a very good experience with this molecule, and I have seen this effectively control almost every aspect of the components of allergies, and with have minimum side effects. So if we compare it, the results of fexofenadine with other antihistamine, I consider it superior, not comparable to most of the antihistamines. The beauty of this drug is that it causes minimum sedation, which is like which in other antihistamine has a significant problem. The other is it is dose convenient, and it has a broad spectrum safety as well. So I suggest strongly the fexofenadine in the treatment of allergic rhinitis.
And what about the patients who you have dealt on a follow-up visits? How was their experience with the use of fexofenadine?
I have rarely seen any patient who have complained me against any of side effects of antihistamine, and especially with the use of fexofenadine. I have full reliance and full trust on this molecule.
Sir, thank you so much for your precious time. With this, we would like to conclude this specific session. Once again, thank you so much for having me.
Thank you so much, Dr.